Well, South Africa has recorded a dramatic increase in the number of excess deaths for December 2020 compared to those of the previous years. Excess deaths are defined as the difference between the observed number of deaths in specific time periods and the expected number of deaths in the same time periods. To put it another way, you compare December 2019 with December 2020 and you find out what the difference is. To unpack what all of this means, we're joined by Professor Debbie Bradshaw from the South African Medical Research Council. She compiles the numbers for the SMRC. Professor, good evening to you. I've seen various estimates of the number of excess deaths for December. What are the official figures? It seems that it's been a very high number.
Hi, good evening, Stephen, and to your listeners. Indeed, the numbers are very high. The Department of Home Affairs, the minister recently gave information about the number of deaths that had been registered in the month of December this year compared with the previous year, where the numbers more or less doubled. And from our work, we take the data a step further and we actually look at the date of death, not just when the death was registered, but when it occurred. And from that, we've estimated that this last week that we have data for, that was covering the new year, 30th of December to 5th of January, there were more than 10,000 excess deaths. So that's over and above what would have been expected.
I mean, this is... I'm sorry to interrupt you. I mean, this is a huge number because at the same time, deaths attributable to violence, alcohol-related, drunken driving, all of those things, and in fact just driving, are probably down quite dramatically.
The unnatural deaths certainly did come down in this last week. What we're seeing is really this surge in numbers of deaths as the second wave of the pandemic is unfolding. And we're seeing that some provinces, KwaZulu-Natal and Gauteng, are still experiencing very rapid increase, whereas in Western Cape and Eastern Cape, the numbers are still very high, but they're not increasing at the same pace. We're hopeful that that's an early sign that the second wave is starting to plateau in those provinces.
I mean, when you first look at a month, as we've looked at here in December, and we see these figures, they seem almost unbelievable. But then when you hear that over 800 people who had tested positive for COVID-19 died in one 24-hour reporting cycle, it means that suddenly these numbers become very, very believable.
They are. They're, you know, in July, we had the first wave peaking in the middle of the month, and there we were getting an excess number of deaths of about 7,000. The second wave, I think, has taken us all by surprise at how quickly it spread, and I assume it's to do with the new variant of the virus, but it has spread incredibly quickly, and we're seeing that increase in the deaths going up with it.
I realize the definition of excess deaths essentially looks at the number of deaths that you could predict, that you would expect from previous experience over a particular time, and then the number that you actually have. But it's not all COVID-19, but it could also be knock-on effects from COVID-19.
Agreed. What we are saying is that there's an increase in the number of deaths from natural causes. I think increasingly we're coming to the conclusion that they mostly must be COVID. They're tracking so closely in the time, the temporal tracking in each region is spot on with the spread of SARS-CoV-2. Of course, we know that our health system has become overburdened in certain areas. and there must be some sort of, what should we say, collateral, but through the overburdening of the health system, that we may also be getting some other deaths coming in as well. But the tracking is it corresponds so closely with the spread of the cases as well.
I have to ask this question. I mean, from what I can see and from what you've said and other information in the public domain, it appears the system of registering deaths is working fairly well. And I'm reminded by crime academics that when somebody passes away, that is almost always recorded because someone's actually died. Have I got that right, that we can be pretty certain about the accuracy of these figures? Deaths are being recorded in South Africa.
You're largely correct. We do think that some are getting missed, particularly in rural areas. Young children, perhaps, the family don't register the death, but largely most deaths are getting registered. And I take my hat off to the Department of Home Affairs. They've been able to cope with keeping the system going. We've got a major challenge with getting the correct information about the cause of death. It is completed on the death notifications by doctors, but that information is still locked up in the process. We haven't been able to find a way to access that information.
There are times when we see a very big increase in the number of new daily cases of COVID-19 reported, and times when it seems that number goes down, and that can be in the same week. I'm not talking about, the gap between the first wave and the second wave. I'm talking about how reporting is actually done. Do you have the same kind of problem where it can take a while for a backlog to actually be taken into account? Where I'm trying to get to is it quite important to look at the number of excess deaths over more than a week, sometimes over a 2-week or a month period, to make sure that you're looking at accurate figures, just to take into account all of the sort of backlogs that can be created during public holidays or long weekends or Christmas or things like that?
So the excess deaths are being tracked through registrations of deaths with Home Affairs. The country's also reporting the daily number of confirmed COVID deaths that come through the health services. And there we do see a bit of lumpiness in the data where perhaps there was a backlog that got cleared up, or there's been a bit of the health service was overwhelmed and wasn't being able to submit the reports on time. So we're keen for the department to also provide a report of the confirmed COVID deaths according to the date of the death, not just the date in which it's reported, so that we can really track the exact timing of those deaths.
Professor, 18,000 excess deaths since the start of the pandemic. I think that figure's from May last year, if I recall correctly. It's a huge figure. I mean, is there anything in living memory that has claimed as many lives over such a short period of time in our history?
Stephen, let me remind you of the HIV/AIDS epidemic. In the height of it, probably 2008 or 9, we were experiencing about 170,000 deaths from AIDS in 1 year. They were spread across the year, so one didn't see it, but I think at one point I do kind of recall complaining that we weren't collecting proper statistics and that we estimated about 1,000 deaths per day due to AIDS were sort of being unnoticed. So South Africa's been through this with HIV. For 2020, thankfully, the mortality rates from AIDS have been declining with the rollout of antiretrovirals. And at the beginning of 2020, we were anticipating that there would be about 70 to 75,000 deaths from AIDS over the year. So, it's that order of magnitude. Certainly COVID looks like a leading cause of death in 2020.